Mod 9 Final Group Project. Creation of Optimal Healthcare System. The optimal U.S. healthcare system must include how it is organized and structured. The best American healthcare system is a healthcare system composed of tripartite organizations. 1. Government. Taxes collected from the people are used to pay for health insurance, based on 2% of each person's monthly income as the insurance fund. 2. Private enterprise. Operating a health insurance company, providing local residents health insurance, PPO. Create profits, provide medical and pharmaceutical research funding, disease prevention, and health promotion. 3. Third-party regulator. Regulation of private insurance operating companies. Drug review. Avoid conflicts of interest. Open and transparent operating financial reports of insurance companies. Health insurance is provided to the citizenry. Equitable care opportunity was available to local residents in the form of PPO. People are free to choose a specialist, family medicine, traditional Chinese medicine, and other primary nursing care. The structure ensures access to care and minimizes health care disparities. Urgent care costs more. Different levels have different costs and user fees can avoid the waste of medical resources. Talking about how the pharmaceutical industry work under the frame, we will go through some number first. The U.S. pharmaceutical industry statistic says that the market share of the U.S. in the global pharma industry will be 43.72% in the year 2023. The pharma industry in the USA spends around $60 billion every year on drug research and development. In the United States of America, on average FDA approves 38 drugs every year. By the year 2025, it is projected that the United States of America will spend $605 to $635 billion on medicine. The pharmaceutical industry should operate as a combination of profit and non-profit entities. This approach balances innovation and accessibility. For-profit companies drive innovation through research and development, R&D, while non-profit organizations focus on producing essential medications and ensuring affordability. We are inclined to establish a triangular framework, with private pharmaceutical companies playing a central role in development. Government entities will provide policy and financial support, oversee ethical considerations, and ensure regulatory compliance within pharmaceutical companies. Additionally, a third-party regulatory body will be established to balance the relationship between the government and pharmaceutical companies. Within this framework, for-profit organizations will provide funding and technology to qualified nonprofit research institutions. The government will offer tax incentives and policy support to these profit-driven entities while regulating their assistance to nonprofit institutions. This collaboration will aid nonprofit research institutions in developing new drugs and refining processes. Meanwhile, nonprofit organizations will distribute these medications to low-income populations. Ultimately, this overarching structure has the potential to benefit all patients. The cost of pharmaceuticals for patients is financed. What can we do? The government, acting as a bulk purchaser, will negotiate drug prices with pharmaceutical companies, similar to the approach taken by other developed countries. What's more, implementing price caps on essential medications and high-cost drugs to prevent price gouging. And we should encourage the use of generic and biosimilar versions of medications to promote competition and lower prices. Providing financial assistance to low-income individuals and families to cover medication costs, ensuring that nobody goes without necessary treatments due to financial constraints. Enhancing transparency in drug pricing and promoting competition among manufacturers to drive down costs. At last, using international prices as a benchmark to determine fair and reasonable drug prices in the U.S. Imagine a healthcare system where inpatient and outpatient services join forces like superheroes, working together to provide you with the best care possible. We're talking about collaboration and communication for continuity of care, and it's more exciting than it sounds. Think of inpatient care as the starting point of your health journey, and outpatient care as the next chapter. When these two teams team up, magic happens. You see, by sharing information and insights, they ensure a smooth and seamless transition from one phase to the other. This means no more lost pieces of your health puzzle and no more starting from scratch. Embracing the integration of modern healthcare technologies, our focus turns to the power of electronic health records, EHRs. These digital marvels bridge the gap between raw data and exceptional care. Imagine EHRs as your health's digital narrative, packing comprehensive patient info for pinpoint diagnoses, tailored treatment plans, and informed decisions. EHRs aren't solo acts, they orchestrate seamless communication among healthcare teams, propelling your well-being to new heights. And the magic doesn't end there. EHRs are pioneers, propelling medical research, unlocking insights, and igniting innovations that shape the future of healthcare. In healthcare, collaboration is pivotal, and the inclusion of TCM practitioners in integrated teams revolutionizes patient-centered care. Traditional Chinese medicine embodies a holistic healing perspective, uniting body, mind, and spirit. By embracing TCM, we broaden therapeutic options, aligning seamlessly with conventional treatments. Patient care extends beyond the physical, encompassing emotional and mental well-being. TCM bridges the gap between conventional and holistic approaches, ensuring a comprehensive healing journey. But it doesn't end there. TCM's allure lies in its personalized approach, empowering patients for active recovery and optimal results. Picture a healthcare team blending Eastern and Western modalities. Collaborative care unites TCM with conventional providers, elevating patient-centered care through synergy, enriching healing holistically. As we conclude, let's delve into a compelling TCM case study. Meet a 62-year-old patient grappling with 2 weeks of sciatica pain. Faced with a month-long wait for sports medicine, she embraced acupuncture. Astonishingly, her initial pain of 9 out of 10 dropped to 3/4/10 post-treatment. Alongside, an herbal formula, Shang Zhong Xia Tong Yong Tong Feng Wan, supplemented her healing. This case exemplifies TCM's swift impact and efficacy, illuminating how timely relief and enhanced well-being are achievable. Moreover, herbal supplements empower patients for ongoing care, embodying a holistic approach to health management.